If you're considering facial rejuvenation using Botox, this video will explain what Botox does, when it can help, how it works, how it is done, and what results you can expect. It may not answer all of your questions, and a personal consultation may be needed. Botox is a very popular cosmetic procedure for correcting visible signs of aging, especially for the upper face, including the forehead, the area between the eyebrows, and the crow's feet lines. Other areas of the face are improved with soft tissue fillers such as Juvederm, Restylane, and Radius. Botox is typically used to treat dynamic creases or folds of the face such as the lateral crow's foot creases, frown lines, and the transverse lines of the forehead. Expanded uses for Botox include eyebrow shaping and improvement of the downward angle of the corners of the mouth. Botox is an excellent treatment for the patient who desires non-surgical cosmetic improvement of the face. Most of the early signs of aging occur in the upper face and eye area. Your Botox injection can be targeted at these selected areas to make those wrinkles less noticeable. We believe that using Botox as early as your late 20s or early 30s can delay the onset of permanent creases. The selective weakening of these muscles of facial expression may eliminate or at least delay the onset of those lines. Botox has been around since the 1970s. Its original use was to correct overactive eye muscles and facial tics. Over the last several years, its use has been expanded to include its cosmetic applications. Botox can dramatically improve all wrinkles that are caused by those overactive muscles of facial expression. It is important to note that Botox will only correct dynamic creases. These type of creases form perpendicular to the pull of the underlying muscle. Static creases, those that are present when the face is at rest, are not treatable with Botox and will likely need some type of filler product such as Juvederm, Restylane, or Radius. Botox works biochemically to block the release of a neurotransmitter, acetylcholine. It is the release of this chemical that causes the muscle to contract. The lines that appear between your brows, around your eyes, and on your forehead result from the contraction of the muscle underneath the skin. This, coupled with time and photoaging, result in a deepening crease. The actual injection process is quite simple. A few tiny injections, and with days, there can be noticeable improvement in the moderate to severe lines. This can last up to 4 months. Results will vary, of course, from person to person. To help me determine where to administer the injections, I will first examine your ability to move certain muscles in your forehead and eye area. The location, pattern, and size and force of these muscles that create the creases are observed. This can vary greatly from patient to patient. To reduce pain, we can apply a cold pack or use a topically applied anesthetic cream prior to injecting. Discomfort is usually minimal and brief. You will see a marked improvement in the treated areas within just a few days. Improvement may continue for as long as a month and could last up to 4 months. Do not use Botox if you have an infection in the treatment zone. If you're allergic to any of the ingredients, if you're pregnant or think you might be pregnant or are currently breastfeeding, be sure to let us know if you have any diseases that affect your nerves or muscles. Be sure that you list the names of medicines that you're using, including herbal products. Antibiotics such as gentamicin, tobramycin, clindamycin, and lincomycin can affect Botox. Medicines used to treat heart rhythm problems such as quinidine can affect Botox. Medicines used to treat different conditions such as myasthenia gravis or Alzheimer's disease. Botox injections are relatively safe when performed by an experienced doctor, but side effects and complications can occur. These include pain and bruising at the injection site, redness, headache, flu-like symptoms, nausea, temporary facial weakness or drooping, eyebrow or eyelid drooping. Expect to resume your normal daily activities immediately. You may have headaches for a few hours after the treatment. Take care, though, not to rub or massage the treated areas for 4 hours. This can cause the toxin to migrate to a different area of your face. If this occurs, temporary facial weakness or drooping is possible. A further recommendation is to activate the muscles in the treated areas 10 times once an hour for the first 4 hours following your injection. If you have any problems following the injection, or if you did not get the anticipated result, please let us know. My attempt is to administer the lowest dose in number of units to give you the best result. Injection of Botox, especially in the forehead, is a balancing act. We want the desired result without creating an overdone, plastic, non-animated appearance. We want to avoid any unnecessary drooping of the eyebrows or eyelids. Especially with the first injection, I would rather under-inject and under-treat rather than over-treat and risk these problems. In general, you must give Botox 7 to 10 days to work. Small touch-up injections may be necessary for final balancing. This is why we charge only for the actual number of units used. I will record the doses and sites for injection, and on subsequent visits, the chances for touch-ups will be reduced. Remember that the use of Botox is more than just eliminating lines and wrinkles. When done properly, Botox is a safe and effective means of non-surgical facial rejuvenation. Knowledge of the anatomy allows us to fill, shape, and smooth by selectively weakening muscles in the treated zones. I hope this video has answered most of your questions about Botox. If you have any further questions about Botox or any other means of non-surgical facial rejuvenation, please let us know. Thank you.